Hello and welcome. Thank you for watching. My name is Steve Duffy, and this is a Revisit Healthcare show. This is where we're helping to usher in a new era of healthcare. We basically want to uncover safe, effective, and scientifically proven natural health strategies to prevent and even reverse, some of our most life-disrupting health challenges, that we're facing today as a culture and society. Again, my name is Steve Duffy. I'll be your host on this particular journey. And today we are really lucky to have Dr. Barbara Macdonald with us. She is a naturopathic doctor, licensed acupuncturist, and doctor of Oriental medicine. She's the author of the Breast Cancer Companion, a complementary care manual. And Dr. Barb has a special interest in breast cancer. And she's regarded as an expert in the field of complementary cancer care with a primary focus on women's health issues. And she is also a member of the Oncology Association of Naturopathic Medicine. So with that, I am going to welcome you, Dr. Barbara, to the Revisit Healthcare Show.
Well, thank you. It's nice to be here.
Well, we really appreciate you taking the time out of your busy schedule to join us and, answer some of our questions about, how do you deal with such a big issue like cancer from a natural health perspective. But let's just start with your background a little bit. You've gone deep into the natural health rabbit hole, but how did you start on that journey in the first place?
Well, I was raised by an osteopathic physician and a mom who did some healthcare support as well. And my upbringing was to only use the body's innate natural healing forces to treat us. I don't think I ever took a medication growing up. I took antibiotics for the first time, ironically, after an naturopathic medical school when I had a pneumonia. That was the first time I'd ever taken one. I was shocked that they actually work really well. But it was, didn't need that for so long. I did have some health challenges as a teenager. Some autoimmune anaphylaxis, you would call it. And a local doctor in Waterville, Maine, where I grew up, Dr. Wong Ken, was a macrobiotic practitioner, an osteopath in my father's office at Waterville Hospital. And that's how they told me what to do. And I did it. And I never had that symptom again. So that's how I remembered when I grew older, finished college, and decided I really wanted to become a practitioner. That's how I looked back on my orientation and the lessons that I learned as a child, that you can heal yourself and that there are obstacles in the way that you have to remove and that kind of thing. So I started off meeting a naturopath in South Florida, Dr. Amber Cariana, and she inspired me to become a naturopath. And it was just, one of those few moments you have in your life and this is what I want to do with my life. And so I went to National College of Naturopathic Medicine, which is now called NUNM. I think it's Natural University of Naturopathic Medicine in Portland, Oregon. It's the oldest naturopathic medical school in the country. And somewhere along that way, I had come from the Upledger Institute, where I was doing more of the business side of craniosacral therapy for people with spinal cord injuries. Before that, I realized I really enjoyed craniosacral and doing more hands-on energetic work. And so I, after graduating, that's a 4-year post-graduate school. I went to University of Vermont and then there. And after a 1-year clinical residency in naturopathic primary care, I did my 3-year Chinese medicine degree. So acupuncture, Chinese herbs, and Qigong therapeutically. And those were all back in the 1997 was the naturopathic, 2003 for the Chinese, practicing full-time at a Women's Time, which is a women's health clinic in Oregon, and that's where I developed an interest in working with cancer patients at that time.
Oh, okay, excellent. So do you use a lot of the like Oriental medicine techniques in your oncology work?
I do. I treat, so I use complementary care most of the time, and have done more alternative care after moving back to Maine. And I do acupuncture, and I'm doing regularly shiatsu and qigong and craniosacral during a session. And so let's say someone's going through chemotherapy and they're feeling fatigue or a little bit of, or a lot of nausea. Some of the chemotherapy regimens cause numbness and tingling of the fingers and the toes, the Taxol group. And so we'll do acupuncture for that. And I do guided imagery. So I believe that our thought process and our feelings and the energy in our body are just as important as our physical experience of the world. And so in a treatment, they get that. Not all patients do that. Some people come from quite a distance, or we have a just a consultation. I can't really be their doctor on the phone, but if we do a consultation, they wouldn't receive the Chinese medicine. I also use Chinese herbal therapy in my practice as a routine as well. Yeah.
Okay. Excellent. Well, I want to take a moment and welcome Lynn for joining us. She's a Revisit Healthcare veteran. And so, yeah, why don't we go ahead and start by kind of breaking things down. And you did a great job in the Townsend letter article that you wrote about cancer care, complementary, conventional, complementary, alternative. Mm-hmm. And you just do a quick definition of those three methods, and then we'll kind of go from there and talk about the things that you mentioned about when they're each is appropriate and when some of them might not be 100% appropriate.
Sure. The different ways that natural medicine can weave or dance alongside or do the work instead of conventional treatments have so many different names, and to be transparent, even my own colleagues use different words. And so we make it even confusing sometimes. And I think there's a bit of a consensus, but not always. Someone who's doing conventional care, we would call allopathic medicine, conventional treatment. Sometimes the doctors themselves, like in letters to me, will say they're doing traditional medicine. We tend to kind of put the word traditional aside for maybe traditional Native American or Indian or Chinese type of care. So you won't often hear a naturopath referring to allopathic medicine as traditional. So let's say someone's having conventional care and they really are concerned about the symptoms, the side effects. They might add the natural medicine as a complement. So we would call that a complementary approach. Their primary approach is surgery, chemotherapy, radiation, oral medications subsequent to treatment, for example. And then the naturopath or a functional medical doctor, or sometimes a PhD nutritionist, or sometimes a Chinese medicine provider, or sometimes there's excellent trained chiropractors who do this kind of work as well. Any of those people who, in my preference, would have some type of license to know the concerns that a patient would have. You don't want to interfere with what they're doing. So complementary should be something that enhances the benefits of the conventional treatment. They are agents that are called synergistic. They would help to enhance it and make it more effective. There are things that can reduce the side effects, and studies have been done to make sure that while they're doing that, reducing the side effects, that they don't also reduce the efficacy of the treatment. We can get into more details about that. There are very well-known long-term toxicities to these conventional medicines that maybe years down the road could result in, say, a heart problem, cardiomyopathy from the doxorubicin type of chemotherapy. And there are wonderful natural things that people can do to reduce that risk. So those are all complementary things. We also would put complementary in after someone's done treatment, prevention of recurrence. And so it is sort of complementing that original treatment, but now it sort of becomes its own thing. Is that alternative? Is that complementary? There's really no, I'd say, post-conventional natural care. Integrative is another word that a lot of people use. And integrative is when the practitioner of natural medicine is working, this is my definition, a little more closely with the conventional doctors. And so I have oncologists and surgeons who refer to me. They're sending me the patient, and I'm sending them reports, and I'm saying, your patient's having a little more neuropathy right now, or they're feeling more tired, or perhaps having more digestive symptoms. I have added this probiotic, or some carnitine, or some vitamin B6, and then I would integrate that care, making sure they know all along the way what I'm doing. And they're sending me lab tests, and sometimes we have phone calls. That's more integrative, but it's still complementary as well. Alternative treatment is something where people forego conventional care. Where that gets confusing is one patient, let's say they had already had surgery, and they're writing something on the internet and saying, well, I didn't do conventional treatment. I only did alternative treatment. But they had surgery, and in their minds, that didn't count. And so you always have to clarify, if someone says they did alternative, do they mean they're doing alternative care after some or all the recommended conventional care? Or did they say no to all forms of conventional care and doing only natural remedies? And the confusion with that also is that, well, what are they using? What have they tried? Are they doing it on their own? Are they working with a practitioner? Are they going to another clinic? And that brings me to facilities. There are natural health facilities that do nothing but alternative. They range everything from, there's a place in Florida that does only raw foods, macrobiotic cleansing techniques, and that would be considered alternative care. There are also clinics where the practitioner is doing a lot of comprehensive natural treatments with or without. And then there are clinics in Mexico, in Austria, Switzerland, and places like that actually have oncologists. There's one in Boca Raton as well, where they have an oncologist or someone specializing in cancer treatment, and they're an MD or a DO. That doctor is administering maybe some chemotherapy regimen, maybe they're doing vaccine therapy, maybe they're doing hyperthermia, bringing the person to a 105-degree temperature and then giving them their treatments. Maybe they're doing intravenous mistletoe, or more advanced and progressive alternative treatments they might be doing alone, and they might be doing in conjunction with regular medicine at the same time. So that's some of the semantics.
Yeah, and there's so many options. It's got to be confusing for people who are using a diagnosis. I can only imagine. So having a doctor you can trust to give you all the information that you see is critical. And I know there are a lot of different roads that you can go down when you're helping somebody out with some, say, complementary methods. But why don't we start talking about, like the environmental factors? Prevention, I think, is probably where natural health shines, because we really talk about how to take care of yourself. But if you're a middle-aged woman or anybody trying to prevent cancer in the first place, what kind of environmental factors do you really need to consider and take into account to prevent something, that kind of diagnosis in the first place?
Right, that's a good question. So we would call it the terrain or a person's constitutional factors that are making them more likely to have one of these spontaneous mutations. So cancer is known as a mutation or a DNA to